Hello and welcome to Tech Talk Community Conversations, the regularly scheduled broadcast from Dr. Jill Bowen, Commissioner of the City of Philadelphia, Department of Behavioral Health and Intellectual Disability Services, in which we explore the work DBHIDS and our partners do together to address the key components of TEC, which stands for trauma, equity, and community. So now let's learn about TEC. Dr. Bowen?
Thank you, Mark. And hello and welcome to Tech Talk Community Conversation, the video series in which we explore how the work we do at DBHIDS and with our community providers and partners aligns to address trauma, achieve equity, and engage community. Today, I am so pleased to be joined by LaJewel Harrison. LaJewel is the president of LGH Consulting and the creator of the HealthELivin app. She has been helping to serve the people of Philadelphia for over 20 years. LaJewel, why don't you tell us a little about the work you do and how it aligns with the priorities of trauma, equity, and community?
Well, good morning, and thanks for having me today. Certainly thanks for having these tech talks. It is, our job to make sure that there are services in the behavioral health space, but a part of that is doing things like this, like informing the community that the services exist, kind of honoring people in this space. And so thanks again for having me here. I feel honored. So my current work in the tech space, as you said, I am president of LGH Consulting, which I primarily do fractional COO work for multiple companies here in Philadelphia. And most of my clients are in the behavioral health space. The great thing is that I do have clients that are not in that space. And so I am able to create likely and unlikely linkages between community partners. And so that we are able to have mental health services beyond our typical spaces. So, it's much needed in that expansion. And so I love this role where I'm able to connect community partners. And
so that is, please continue.
No, go ahead, Jill. Sorry.
Okay. So that is really fascinating to me. And first, you've done a lot of work in the past decades with the provider network in lots of different ways, working directly for a provider, being on boards, the chair of CCCP, and consultant to the Philadelphia Coalition. I mean, there's been a lot of ways in which you have been involved in the provider network in Philadelphia. What made you look to develop your own company in your own space to contribute? I'm very interested in what your thought processes were and what the gaps you saw that you're looking to fill.
Yeah, so I started out in the mental health, behavioral health space as a case manager many years ago, providing direct care in that space, and then had received promotions and was the director of the unit, and then began to oversee case management and outpatient, and then case management, outpatient, and family-based, and then just adding on units until after almost 20 years, ended up as executive director for the facility. And in that experience, there was the direct care experience. There was the experience on the primary level of supervising the unit. And I got to see a different perspective from managing the departments and having relationships with funders, starting new programs, and really trying to collaborate with the community in a way. I believe it was just time to move on so that I could create bigger partnerships with the community. That if I had exited that space as under one provider, right, that I could be more effective interacting with multiple providers throughout the city. And so that was that transition. In this new space where I don't have to kind of be primarily just fixated on one provider, right? And so when you're in that seat as manager, executive director, you want to make sure all of your employees, remain employed, that your programs stay viable, that your funders are satisfied, and you become, because it takes a lot of time, you're certainly fixated in that internal space. So in my role now that I've stepped out, as I said before, I'm able to connect unlikely partners and integrate services in a way that I wasn't able to in the role under the roof of just one provider.
So how do you use that position and that space to move forward in the equity sphere?
So what we know, we could just talk about Philadelphia now, right? So what we know is that everyone does not have equal access to services. And so there are a lot of hindrances in that area. And some of them are just like physical access, geography to departments. And I know DBH, CBH, you guys do a great job of making sure that you have providers in a lot of neighborhoods. But then another part of that is making sure that once you get to the door, that there are providers who look like you and who can speak to your experience and who are welcoming, right? Because you want to make sure that people go in the door and that they stay and that they return for services. And that really affects access to care. And that's what we do at CCCP, is that we make sure the care is culturally competent, culturally appropriate, because we know that matters when you talk about access to care. So we place a lot of focus on making sure the service providers reflect the community and the culture that they physically sit within.
Yeah, and critically important. I think in some ways now more than ever, given the highlighted disparities and all of the trauma that the city is facing. And what is your thinking in terms of, I mean, there's so much distress out there, and yet utilization isn't as high as you'd expect it to be in terms of utilizing the services. What are your thoughts about the roles that you are in now, the positions that you're in, and how you might be able to help move that so that we are making sure that folks who need the services are able to connect to them as easily as possible?
So we experienced a little of this, and I'm probably saying a little of this because we have become so comfortable in our pre-pandemic state, right? Where we understood that level of crisis and need within our city. And then we were isolated for, almost 18 months, and the crime in our city increased and poverty seems to have increased. And, people had to deal with death from sickness, and then death from violent crime, and then the visual of it, right? So the trauma is compounded because we're watching it on social media and we're watching it in the news, and it's just been a lot to handle. And so our potential base of people to receive service grew, the need grew, and our industry didn't grow certainly at the same pace at which the need grew within our city. So we're dealing with that now, right? That's affecting access. But we haven't addressed the stigma that's attached to mental health issues, mental health services within the very specific communities. And I can speak to the African-American community. So, pre-pandemic, this wasn't fully addressed. And so now we're in an extreme crisis, and we haven't quite established the relationship that's necessary for people to turn to you in the middle of a crisis. Mm-hmm. And so that's why we have to have the agencies and fully engage with the agencies that are on the ground, doing the footwork, knocking on doors, making sure that their staff are out there servicing people. So there's this pre-crisis work that has to happen in order to fully be accessible when people are in desperate need. So the knowing that you exist, the trust work, the community work has to be established. And so in my role with LGH Consulting, again, just connecting providers with people out here doing other community work. And so a great community provider right now, and I'll give an example, is Mother in Charge, right? And so you have Dr. Dorothy, who's been doing the work for almost 20 years in this space, having to comfort families because they have loved ones that are victims of violent crime, gun violence. Now, connecting her with providers and connecting Mothers in Charge with providers of mental health services, right? So it's not just, hey, we're coming out and here are these social services that are available to you, but hey, here is a therapist and here are group grief counseling, and there's a way now that you can have the mental health providers connect with the community that they could not have because Mothers in Charge has the relationship with the community, right? And so there is this overlap work that really helps break down the stigma and bring people into spaces that normally would not have come in.
That is tremendously helpful, clear, and it's great that you are moving in that space to help make those connections. And those programs, like so Mothers in Charge, well established, has been around for a while and doing extraordinary work for some time. And then there are others that are sort of popping up in response to the high degree of trauma, violence, the challenges that are so evident in the communities. So how do you move in with some of the newer folks that aren't quite established, but might actually be sort of developing and evolving with that trust sort of in place, because it's coming, from the community in response to what is happening, and actually like grows with that trust sort of embedded in it. And how do you differentiate some of these really well-established, community services and connectors with some of the new ones that are sort of emerging in to a large part in response to the multiple layers of trauma?
What I'm finding are the well-established, certainly well-intentioned agencies that already exist, have their relationships and their branding, so to speak, out there, their name out there, the marketing, and so people know that they exist. And so when you have a smaller organization that is just starting in response to this, what I'm finding is that they typically come from the neighborhood that they are desiring to provide services, right? So even when they start out small, they already have relationships, even some small relationships that are the seed that will grow authentically in that neighborhood, and that trust will run deep because of that. And so they can survive, and they will have relationships that even the larger organizations that have existed for over 20 years just did not have, because these are people that are in the neighborhoods that exist, operate, live, work, children go to the school within the neighborhood, and that matters, right? And so their care is different, their knowledge of what's going on is much different, and their knowledge of key players, how things are moving along. All of that matters when you decide to provide services, because you can now cater to your specific audience. And I think they will do fine in that area. I'm finding, because I have organizations that contact me for the back end programmatic support. And then I'll come in and say, oh, I know you called for me to design this program or to structure your budget to make it more profitable and all these other things, but I think you collaborating with this other organization or operating in this space would be great for you, right? And so I can see how amazing they are, what their strengths are, and connect them with another agency to pull out their strengths. And in that way, they can have some back-end support. They can have, like the smaller agencies just do not have the funding needed to really grow and multiply these much needed services. And I can connect them to, people like DBH, CBH for funding, but also to other providers that are operating so that they can collaborate.
Great. Yeah, that is fantastic. So you go in with your expertise, your knowledge, and you're able to see things in a little bit of a different way than they do, and you can help them to make the kinds of connections so that they're successful, therefore they're able to provide for the community. We talk about, communities where healing happens. But you're describing, I think, the infrastructure and the fabric of why that happens or how that works, and really appreciate the work that you're doing. So, I mean, would love to keep talking for a long time with you about this, but we have limited time. So let me ask you about what your plans are going forward. What are your goals? What are you hoping to achieve in the coming months as we wind up calendar year 22 and head into a new year, hopefully, healthier and safer? What are your goals for your organization, for yourself, and for the city as we move forward?
I'm so encouraged to continue this work of connecting community providers. Every time I see a great outcome, every time we overcome a small hurdle and I see them, get back into the community and do the work, I know that this is my purpose work and that this is where I belong. So I hope to do a lot more of this. I've also, as we mentioned earlier, created a HealthELivin app, which at the core of it is mental health screening tool in your hands. And so I am looking to collaborate with a lot more community providers around expanding this, getting this out to the people and making great use of it. So that also affects the access to care. We want the information out there. We want, mental health language, mental health screening tools, all of these things to be ubiquitous in our community to break down the stigma. We want it in all spaces. And I believe putting it in a phone that we're constantly staring at all day in our hands really helps with that.
Well, this is wonderful. Thank you so much, LaJewel, for your time today and for the work that you do for the people of Philadelphia, for the communities, for us all. And we thank all of you for watching the DBHIDS Commissioner's Tech Talk Community Conversations. Our next Tech Talk will take place in January for our community conversation, when another guest will help us learn more about the important work our organization and our partners do to address trauma, achieve equity, and engage community. So thank you, and LaJewel Harrison, Tech Champion. Thank you.
Yeah.